Hey guys, welcome back to Denver Wellness Digest. As always, Chris Perez here, bringing you tips and information to improve your mental wellness. Last week we talked about treatment-resistant depression. So this week I wanted to start talking about some of the common treatments for depression. And to do that, we're going to jump right in with one of the most commonly prescribed classes of medication for depression. And that's the SSRIs, the selective serotonin reuptake inhibitors. And as you remember, serotonin is the neurotransmitter or hormone that's responsible for feelings of well-being and happiness. For a long time, the theory of depression was that people who were experiencing depression just didn't have enough serotonin in their brain. So these medications were designed to decrease the reabsorption of serotonin, and in doing so, leave more serotonin in your brain and help you feel better. Okay, so three really common SSRIs that are prescribed for depression are Prozac, Zoloft, and Lexapro. So a lot of times if you've gone to your primary care provider and you've said, you know, I'm just not feeling great, I'm feeling really depressed, I'm feeling really sad, they might start you off with one of these medications. There's a whole bunch of other medications that happen to fit into this class, but these are three really common ones. So let's start off with the benefit. Okay, as you would expect, the goal is that these medications help improve the level of serotonin in your brain and help you feel better. Now, that effect can take 2 to 6 weeks to really be noticeable. And a lot of people really need that 4 to 6 weeks to feel the full effect of the medication. It can sometimes take as much as 6 months to feel that benefit. Now that's the good part. The negative side effects oftentimes really discourage people from continuing on those medications, all right? So get ready, this is kind of a long laundry list. Some of the really common side effects include dizziness, headaches, nausea, vomiting, irritability, sleeplessness, drowsiness, dry mouth, nervousness, agitation, restlessness, appetite changes including weight loss or weight gain. And one of the most distressing side effects for a lot of patients are the sexual side effects. And that includes things like not being able to reach orgasm, loss of sexual desire, and the inability to maintain or get an erection. And that can be really distressing to a lot of patients that first start on these medications. Now the hope is that as your body gets used to these medications, that the side effects kind of go away. And one of the ways that they try to, decrease some of the side effects is by prescribing these medications to be started at a low dose and have you work up to a higher dose. That's really a lot of times called tapering a medication. And so if you're just starting on one of these antidepressants, it's very common that you'll be given a very low dose to start and work up towards a higher dose. And so that can sometimes, increase the amount of time that it takes to see that benefit. If you're stopping these medications, it's important to let your prescriber know because they may want to taper off the medication depending on which SSRI it is. Also, one way to decrease the nausea and vomiting that you may get is to take these medications with food. It's also really important to let your prescriber know if you're taking any kind of herbal supplements or any other pain medications or blood thinners, because the two medications together can cause some really unpleasant side effects like increased bleeding. And while we're talking about that, let's mention one of the most rare but definitely the most dangerous side effect of these medications. And that's serotonin syndrome, or a serotonergic crisis. Simply put, it's a situation where you have just way too much serotonin circulating in your body and your brain. Like I said, it's extremely rare, and if it does occur, it usually occurs because you're taking two medications at the same time that are increasing that serotonin, and somebody's not aware of that, right? Like a provider or your pharmacist. These symptoms, and they would include things like anxiety, agitation, high fever, sweating, confusion, tremors, restlessness, lack of coordination, and major changes in blood pressure or a really rapid heart rate. So if you're experiencing any of those symptoms, it's really important to get medical help immediately. But as I said, that is incredibly rare and not an expected side effect. As we said in last week's video, it's not uncommon that this first round of treatment really isn't helpful for you. And if you've been taking one of these first-line antidepressants and it's not really working for you, be sure to talk to your prescriber. And you may want to consider reaching out to a psychiatric professional, like the psychiatric mental health nurse practitioners here at Alleviant or a psychiatrist. Those guys are experts in these classes of medications, and they can really help you find a different medication or a combination of medications that give you the benefit that you want while decreasing. So really, in short, that sums up the SSRI antidepressants. And if you like what you saw, click like and subscribe below, and we'll see you next time.